The concept of debridement and disinfection. Debridement and disinfection are entirely two different things. Debridement means the removal of physical debris, such as the gummy plaque on teeth. But after the plaque has been removed, then we need to go in there and disinfect, and that is remove residual bacterial toxins and so forth. Decontamination. This, as I said, is a combination of debridement and disinfection. And the areas where this concept can improve your health is orally and also on the tongue, the nasal cavity, the maxillary sinus, the lungs, the foot and the toe, where you might have a fungus there, and in the ear, and also some theoretical thoughts on what impact this can have on the HPV, or the human papillomatus virus, that has been associated with certain forms of oral cancer. Sodium hypochlorite is the most effective disinfectant that we're going to be talking about in this video, and this is the active ingredient in household bleach. And we use this in an extremely weak solution. Previously I talked in terms of 1 teaspoon to a quart of water, but actually found that this needs to be discarded at the end of the week because it breaks down, and therefore it's more practical to put a half a teaspoon to a pint of water, and we'll talk about that more in detail. But how safe is sodium hypochlorite? And sodium hypochlorite has been used and recommended by the Center for Disease Control for making potable water out of contaminated water. If contaminated water is clear, they simply add 1/8 of a teaspoon to that, and that makes it drinkable. If the water, however, is cloudy, then we add 1/4 of a teaspoon to that. Sodium hypochlorite can be used in a water irrigator in the case of a periodontal pocket as well as a periodontal defect. So this is a video that you can look at, but let me go into some detail on that. On the left, we see a pocket. On the right, we see a defect. Now, what is a periodontal pocket? First of all, this is where the probing depth is in excess of 5 millimeters. Periodontal defect also means the probing depth is greater than 5 millimeters. A periodontal pocket is diseased. However, a periodontal defect generally is relatively healthy, because this is what results after periodontal treatment, where we were not able to eliminate the pocket completely. And certainly with a periodontal pocket, there is significant inflammation. However, with a periodontal defect, any inflammation there is minimal. And a periodontal pocket bleeds easily on probing, but a periodontal defect, if properly maintained, does not bleed on probing. A periodontal pocket requires treatment, and as I said earlier, a periodontal defect does not require treatment, because usually it is a residual defect that lasts after pockets have been treated. The disease tends to progress on a periodontal pocket, whereas generally a periodontal defect is stable and can be kept stable over the years by routine maintenance, good home care, as well as irrigating the defect with a sodium hypochlorite solution. Suppuration is present in a periodontal pocket, but there should be no suppuration on a periodontal defect. Now, with water irrigation, this can impact both a periodontal defect and a periodontal pocket. The key is to stabilize the periodontal defect and maintain it in reasonable health using the water irrigator. The protocol for this requires a greater volume of sodium hypochlorite solution to fill the reservoir. So 1 teaspoon to a quart of water would be a minimum. But if you're going to use a lot of this solution, put 4 teaspoons to a gallon of water, and therefore you will have a greater volume to use. And like I say, regardless of whether you use a pint, a quart, or a gallon of the solution, it should be emptied out at the end of the week, because we're not sure how stable it is, and it may go ahead and break down. Oral decontamination and disinfection. First of all, we're going to talk about the teeth. We're going to go in there and debride, and we do this with a toothbrush and floss generally is what we do with that. And then we disinfect with the sodium hypochlorite solution. Now the tongue is somewhat different. 90% of the bacteria left in the mouth after we have debrided the teeth is left on the posterior part of the tongue. And these bacteria are sulfur forming and give off the aroma of rotten eggs. But you go in there and debride using a tongue sweeper, and I'm going to show you that in just a minute where you might order that. And then we go in there and disinfect with the sodium hypochlorite solution. So this is the website to go and look, and you can order actually the tongue sweeper from Dr. Robert Rippich on that, or below is an 800 number where you can call and order directly. Sinus debridement and disinfection. Debridement of the sinus can be done by using a nebulizer, which can be used to irrigate the sinus with a saline solution. Or if you happen to have a nasal infection or sinus infection, you can certainly use the sodium hypochlorite solution, 1/4 of a teaspoon to a pint of water in your nebulizer on that. So this is the nebulizer that I like. You can go ahead and order that online. I think it's only $6 or $7. And individual packets of not sodium hypochlorite, but individual packets of saline can be ordered separately to mix up the proper solution. Potential impact on lung infections. And pay particular attention to this because we're talking about pneumonia and other lung infections. And we're going to talk about the association of respiratory pathogens on the tongue and the development of pneumonia. And this was an article that was published in 2018, which gave I think, some interesting information, which I think you should think in terms of. The importance of debriding and disinfecting the tongue. The tongue is recognized as a reservoir, the plaque on the tongue, for respiratory pathogens. The previous study mentioned the two significant ones that we're going to be talking about are H. influenza and P. aeruginosa. First of all, in this study, and we're going to talk about that a little more in depth, they took tongue scrapings and found samples of those two particular bacteria. Then when pneumonia developed, they again took tongue scrapings and they also took sputum samples and compared and found these bacteria in there. So let's talk about the study. First of all, the test subjects were 60 patients in a long-term care facility. Second, the study lasted for a year, and during that time, 17 of 60 patients, 28%, developed pneumonia. Bacterial samples were taken as previously mentioned. The tongue scrapings initially, the tongue scrapings when pneumonia developed, as well as sputum samples when pneumonia developed. All the samples demonstrated a similar respiratory pathogens, particularly the two that we mentioned earlier. So based on this information in this study, common sense supports the concept of tongue debridement and disinfection, in my opinion. Now let's talk about another application of this concept. And this is a problem that I have dealt with for years and finally came up with this solution. And that is debridement and disinfection of the toe, fungus, and athlete's foot, which I fought this for years, I guess 20, 25 years before I finally found the solution to it, which now I'm going to show you. Let's talk about debridement first. And first of all, to debride, you want to get a foot file, which you see below, and go ahead and file the feet, the calluses and things like that. And then you're going to go ahead and disinfect using the sodium hypochlorite solution. So now let's talk about disinfection of the foot fungus, athlete's foot, and the like, and the toe. And what I did is I would mix up a quart of the sodium hypochlorite solution, the formula that we talked about earlier, 1 teaspoon to a quart, and I would soak my feet morning and night for about 2 minutes each time over a period of time. Now let me tell you what, this is a slow process, so don't get impatient with it. And I don't know whether this makes any difference or not, but every few days I would simply file my nails just to keep those fresh. Now whether that stimulated any growth or not, I don't know, but it's just something that I did. So here's a picture of the big toe here, and it talks about during treatment. Now originally on that foot toe fungus was all the way down to the quick, and I can't really tell you how long it took to grow out to the point where you see under during treatment, but I would say probably 6 to 8 months. And then you see during treatment, and then you can see on the right the way it looks now after it's grown out another 4 months. And I have an idea that that toe will grow out and I'll have a perfect nail within the next few months. Now, if we're going to go through this process and go to all this trouble, you don't want to reinfect. So therefore, I started wearing shoes that look like this. They're not actually dress shoes and they're not actually running shoes, but they're a fabric that can be soaked. And I had a couple of pair of these shoes. And so what I would do is I would take one and soak it in the sodium hypochlorite solution as described before and let it soak overnight. And then set that aside and let it dry for a few days and wear another pair. Now, you don't need to disinfect these shoes but one time unless you feel like you're going to get reinfected on that. But I think if you'll find in doing that, it'll be absolutely amazing how much better it's going to make your feet feel. Now, in closing, let me give you a few more thoughts about toe hygiene and comfort. I've gotten rid of my toe fungus. I've gotten rid of the calluses on my feet. My feet are nice and smooth. So still from time to time, I take that file and freshen my feet. But one thing I do at night when my feet are tired is soak my feet in Epsom salts for a few minutes, and that keeps them soft. And it's amazing how the sense of touch you have and how comfortable your feet feel when you're walking the next day. So try this and see how it works for you. Debridement of the ear. Certainly as we get older, at least in my particular case, I have found that I build more earwax than I did as a younger person, and to some ways this impacts my hearing. Let me talk about the procedure for ear debridement. First of all, you want to tilt the head to one side and drop some of this Debrox solution, which you're going to see in a moment at the bottom, and place a cotton pledget in there and leave it for a few minutes. Then when you remove the cotton pledget, you can take the little bulb that you see to the right and flush that with warm water, and that will flush out the softened wax. Theoretical impact on the human papillomatus virus, or HPV. Certainly there is a vaccine out now for HPV, but many people, or most people, have not used this. And this is an etiologic factor in development of certain oral cancers. And although I said as a vaccine has been available, going in there and rinsing and gargling with this may have an impact on preventing that. Here are some videos that you can go to my website, pdmillerswebtextbook.com, to get additional information on the things that we're talking about here. But if you're going to use the sodium hypochlorite, we need to have a disclaimer on that. This information is being presented for information only, and you should only use it at your own risk. I would like to emphasize what the CDC did, acknowledging that this can be swallowed in very dilute solutions. Second, this is not a prescription, and as I said earlier, the solution should only be used at your own risk. Under no circumstances should you swallow it. Children should not use the solution because they may inadvertently swallow some of it, and certainly expectant mothers or women anticipating pregnancy should not swallow this because we do not know the impact on the developing fetus. So I looked up on Medline Plus the side effects of ingesting sodium hypochlorite or household bleach. Drinking bleach can cause effects that range from mild to serious, depending on the amount ingested. Medline Plus states that consuming diluted bleach or sodium hypochlorite may lead to mild stomach irritation. Ingesting larger amounts can lead to a gagging sensation, pain in the mouth and in the throat, burning in the esophagus, chest pains, low blood pressure, slower heart rate, delirium, coma, shock, vomiting, and stomach and abdominal pain. And obviously, if enough is ingested, it could cause death. So anyway, for those of you who are professionals watching this, I would suggest that you try this protocol or these protocols in your own mouth and select those that you think may be applicable to suggest to patients or family and friends, because I have found that this has been so very impactful on me personally.